Hello and welcome. Today, we're cracking open a fascinating medical case file. We're going deep inside the stomach to investigate a condition you've probably heard of, but maybe don't fully understand: peptic ulcer disease. It's a hidden battle, and we're going to uncover how it all goes down.
You know the feeling, right? That burning, sometimes gnawing pain deep in your gut? It's so easy to just brush it off as, oh, it's just a little heartburn or something you ate. But what if that feeling isn't just random? What if it's a distress signal, a clue to a much bigger mystery? Well, that's what we're here to figure out.
Okay, so like any good detective, the first thing we do is follow the evidence. Our number one clue is that burning feeling. So where's it really coming from, and what is it trying to tell us? What's really wild is that your stomach is basically a constant war zone. On one side, you have the attackers. We're talking powerful stuff like gastric acid. On the other side, you have these incredible resilient defenses. That burning pain you feel, that's the alarm siren. It's the signal that the attackers are starting to break through the defensive wall. So when that defensive wall gets breached, what does the evidence, the crime scene, actually look like? Let's get a really clear definition of what this injury, this ulcer, actually is. Yeah, the official definition sounds super technical, I know. But here's the key thing to remember. An ulcer isn't just a little surface scrape. No way. It's a deep break in that protective lining. It's a wound that's actually penetrated past the first few layers of your digestive tract. This is the perfect way to picture it. Imagine your stomach lining is this perfectly smooth highway, letting everything run efficiently. An ulcer is like a deep, nasty pothole. It's been eroded and eaten away, and it disrupts the whole system. And just like in any investigation, location is everything. The location of that pothole gives us critical clues. If it's a gastric ulcer, meaning it's in the stomach itself, the pain usually hits you right after you eat. But if it's a duodenal ulcer, in the first part of your small intestine, food can actually buffer the acid for a while, so the pain might not show up for a couple of hours. The timing literally tells a story. All right, every investigation needs its suspects. So who or what is actually causing these painful potholes? Well, it turns out that for the vast majority of cases, we can narrow it down to two prime suspects. So let's get a look at our lineup. Suspect number one we'll call the invader. This is a remarkably tough bacterium called H. pylori that actually sets up camp in the stomach. Then we have suspect number two, the inside job. This is the chronic use of NSAIDs, non-steroidal anti-inflammatory drugs. You know them, stuff like ibuprofen and aspirin. And let's be crystal clear, these two are not minor players. They are the main event. H. pylori infections and regular NSAID use are behind the overwhelming majority of all peptic ulcers. Everything else is pretty rare by comparison. So this tells us exactly where we need to focus our investigation. Okay, so we've got our suspects. Now for the fascinating part, their MO, their method of operation. How do they actually manage to get past the stomach's incredibly tough defensive wall? So let's quickly reset the scene. The defense is this thick, protective mucus layer. The primary weapon of the attack is gastric acid and an enzyme called pepsin. Normally, the defense is more than strong enough. The job of our suspects is to sabotage that defense. Let's start with the inside job. NSAIDs work by blocking certain chemical signals to reduce pain. The problem? Those exact same signals are what tell the stomach to keep its protective mucus layer nice and thick. So when you block the signal, you're basically accidentally telling the stomach to lower its shields, leaving that wall vulnerable to acid. And now for the invader. Honestly, H. pylori is diabolically clever. To survive in the superacidic stomach, it actually secretes an enzyme that creates a little neutral force field around itself. Then, once it's safe and sound, it starts releasing these toxins that directly damage your cells and completely mess up the stomach's whole acid control system. It's a really sophisticated attack. So, the wall is breached. The alarm bells are ringing. It looks pretty bad. But now it's time to call in the good guys. Let's look at the strategies and treatments we can use to fight back, heal the damage, and bring back the peace. Treatment isn't just one thing. It's a full-on counterattack with 4 key strategies. First, neutralize the acid that's already there for some immediate relief. Second, shut down the factory that's making more acid. Third, help rebuild and reinforce those defenses. And fourth, and this is critical, if H. pylori is the culprit, you have to completely eliminate the invader. Now, how we shut down acid production is really neat. Think of it like a factory. H2 blockers are like cutting off some of the work orders so production slows down. But proton pump inhibitors, PPIs, they're different. They go right to the main power switch on the assembly line, the proton pump, and just turn the whole machine off. That's why they are so much more powerful. So let's lay out all the tools on our evidence board here. This table shows the entire therapeutic arsenal. You've got your quick fixes like antacids, you've got the heavy hitters like PPIs that change the whole environment, you can even apply a kind of liquid bandage with mucosal protectants. And of course, when you're dealing with H. pylori, you bring in the special forces, the antibiotics. And this is a hugely important piece of information when dealing with the invader. You can't just reduce the acid and hope the bacteria gets bored and leaves. No, the goal is total eradication, and that means hitting it with a powerful combination known as triple therapy. A PPI to lower the acid shield, making the bacteria vulnerable, and then 2 different antibiotics to make sure there are absolutely no survivors. So we've gone through the crime scene, the suspects, their methods, and the reinforcements. What's the final lesson here? What's the ultimate takeaway from this whole internal battle? It really all comes down to a single word: balance. Your digestive health is this delicate, incredible equilibrium between the forces of attack and the forces of defense. A peptic ulcer isn't just some random event. It is a massive, flashing sign that this critical balance has been dangerously thrown off. And that leaves us with one final thought. Now that you understand this constant battle going on inside you, and you know who the usual suspects are, like those common painkillers, how does that change the way you think? How does it reframe that harmless heartburn? And what does it mean for the choices you make for your health every single day?